right, this is video 2 for your anatomy chapter on the muscular system. We're on page 228, which is right where we left off with video 1. So now we're going to talk about the movements produced by muscles. And this is going to look familiar because we talked about a lot of these same movements when we were in the skeletal chapter. So hopefully you've already started working on learning these. So the first one is the flexion and extension. So to extend your arm is extension, to bring it back in is to flex it. Okay? And this picture actually adds in what muscles are responsible for those prime movers and those antagonists. Extension can also be on the leg, as it shows there. We already talked about abduction and adduction when we were doing this skeletal chapter. So abduction, abduction is to move away from the body. I use the analogy of abduct. And then adding means putting things together. And so we're bringing it towards the midline and bringing the arm back towards the body. Rotation and circumduction we talked about already in the last chapter too. Okay, so supination and pronation. We are talking about the hand. So supination and pronation has to do with whether your hand is palm up or palm down. And so when we talked about body position, supine means to lie on your spine. So supination is kind of being your hand being on the spine of your hand. Well, when you look at your hand, which one would be like the back of the body, like to equate to your spine? And it would be this side. So this is the supination, means what this is face down. So pronation would be palm down. Okay. The next two movements is called dorsiflexion and plantar flexion, and these are foot terms. Dorsiflexion is with the toes pointing upward. So if you're standing on your heel and you're bringing your toe up off the ground, that's dorsiflexion. Plantar flexion is pointing your toe, like standing on your tippy toe like a ballet dancer might do. That's plantar flexion. I've had students tell me they remember that from think that you're planting seeds and you're pushing the seed into the dirt with your toes. You're planting seeds into the dirt. Okay. Inversion and eversion are ankle movements, and you can actually see that here in the picture. And it has to do with your foot tilting a certain way. And this can cause ankle problems, knee problems, even up to back problems if your feet are not walking on the correct way. You can get this from foot problems, different fascia issues. It could just be like my daughter has issues with this that stem from her knees. She's got a lot of bone on bone in her knees, and her feet always go out. So one thing that she has to do is wear really good shoes. And she likes to buy cheap shoes from Walmart. And I tell her that that is part of her problem, because then she has all this knee pain and foot pain. And I say, your shoes are your problem. You buy cheap shoes. And it's what she can afford. I mean, it's where she wants to buy the shoes. And I tell her that for work, because she works as a caregiver, as a CNA, I said, you should buy work tennis shoes, and you should buy really good ones. Go to Dunham's or some sporting goods place and buy some really good shoes and spend some money on it. But then only wear those shoes for work, and wear your cheap shoes when you're running around and playing outside or whatever, camping and other things that she likes to do. Because then your work shoes that you spend a lot of money on will last a really long time because they're not being beat up. You're just wearing them indoors when you're working. So she doesn't want to hear that because she doesn't want to have to spend that much money on shoes, but she's creating some of her own pain because of shoe issues. The muscles. Do you have to learn all these muscles? Well, no, but yes, but no. Um, you should be familiar with them. When we get to coding for conditions for patients, there will be things like muscles of the upper extremity, muscles for the neck, muscles for the lower extremity, muscles for the glutes. And so knowing which muscle categories those are, it will come into play with coding. There are certain muscles that you should learn that are the most common injection sites. We inject into the deltoid. We inject into the vastus lateralis, which is the leg one here. And we inject into the gluteus minimus. And I don't even see that on here. We only have the gluteus maximus labeled here, but the gluteus minimus is the muscle right above it, which is like the top of the butt muscles. And so those are the three most common injection sites in a doctor's office. The vastus lateralis is usually used in babies for vaccinations and things. As we age, we don't get so many in our legs. It's more arm and buttock at that point. But it just depends on what we need. So are those all you need to know? I'm not saying that. Coding wise, you probably need to know a whole bunch more, but it will just come with experience. Then it runs through a bunch of your muscles. Obviously, your face has a whole bunch of muscles because our face can do so many different movements. I have a couple of them that I just kind of like. The masseter, whoops. The masseter is this muscle here, and that's your chewing muscle. So I kind of like that because I like to eat. And then you have the orbicularis oris. I really like this one too. It's actually a muscle that goes all the way around your lips, and it's the one that allows you to kiss, go, to smack your lips. That one's kind of a fun one. The sternocleidomastoid comes all the way down your neck like this. So I know from time to time I'll get like cricks in my neck and things that are twinges from here. And then, of course, all those back ones that hold your head up straight that get kind of sore sometimes. But we have all kinds of muscles here. We have one that goes all the way around our eyes that kind of allow us to do a lot of our eye movement and things like that. So there's some really interesting ones there. Our abdominals, we, hear about, the six-pack in the abdomen. That's our rectus abdominis that comes through here. But then it's covered by this fascia, so you don't see it when you're cut open. You actually have to, get through that fascia before you see some of that. But then you have muscles on the sides as well that allow us to do all of our movement. The upper extremities and the lower extremities are all listed. Okay. All right, I'm going to stop the video here and we will pick up with diseases starting with infections in video 3.